That is good news. The Prime Minister has tonight confirmed that 500,000 people, more than 500,000 people, have now been vaccinated, which is a great start given the limitations of this particular vaccine in the way it has to be stored and transported, though they will have to improve those numbers considerably if they want to get all those on the priority list vaccinated by Easter. But more immediately is the question of this new variant of the virus and the implications of these mutations. We did learn more today, though there are still a number of unanswered questions. But at a special media briefing, we were told that this afternoon more than a dozen scientists went through all the data again and are now even more convinced that it is more transmissible, more infectious than earlier versions of this virus. Somewhere they are now saying between 50 and 70%, which is slightly lower than what we were told on Saturday, but whichever way you look at it, that is still a lot of transmission.
Victoria, what about whether or not this virus is more dangerous? Do we have clarity on that?
There is absolutely no evidence to show that, nor is there any evidence yet that it will affect the vaccines, though they are doing a lot of work in the laboratories at the moment to determine this, of course. What we did hear today is that there is a hint, and it is important to stress that it is just a hint, that it may be infecting more children than the previous version. There is no suggestion, though, that it targets children. It could be just that they are mixing more than adults because they've been back at school and they don't seem to be getting any sicker. But what they will need to monitor is what will happen now that schools are shut. And I have to say, the feeling from the briefing is that the next fortnight will give us some more answers and may help the government in terms of what is needed and what different control measures will have to be put in place. But again, they did emphasise that this new variant can be found across the country now. It's not just contained to London, the southeast and the east, and that it is spreading.
Thank you very much, Victoria. Well, we're joined now by the epidemiologist, Professor John Edmonds, who's a member of the government's SAGE advisory group. Professor Edmonds, thanks for joining us. Can you just clarify, when we talk about this mutation, it's not just a way of frightening us or explaining a change in government policy. It is genuinely something to be concerned about.
Oh yes, it's a genuine concern. I mean, the government aren't in the business of just trying to frighten you for no particular reason. This is a very significant event, unfortunately. So this virus does appear to be significantly more transmissible than the viruses that we've been dealing with up to this point. And of course, we've been struggling to deal with viruses up to this point. It's very difficult. It's been a huge effort undertaken by the country as a whole to try and keep a lid on the epidemic, over the last few months and indeed over most of the last year. And we've struggled. This virus now is much more transmissible than the ones that we've been dealing with. So this is a really big, unfortunately, a really significant change.
You've been quoted as saying that this mutation is the worst moment in the pandemic. Is that because of the transmittability? Why are you so concerned?
Yes, simply it seems to be so much more transmissible than the viruses that we've been dealing with up until this point. And it comes at the point when the health service is already stretched. So across the country, many people, many hospitals are stretched. And on top of that, now we have a new strain that is rapidly expanding. And so we would therefore expect to see, unless urgent action is taken, we would therefore expect to see an increase in hospitalizations and deaths, unfortunately, over what we already are having to cope with. So that's why we need really urgent action to be taken. The government have actually acted pretty fast, so and we'll see what the outcome is now.
So what does that urgent action look like beyond London and the south east and the east of England? Because we heard suggestions at the Downing Street press conference that it has spread across the country, perhaps in smaller amounts. But are we looking at Tier 4 or some sort of lockdown for the whole of England then?
Well, I think that's the sort of lesson that we have to learn. We have to stop. So if something starts to spread, then we have to stop it as early as we possibly can, instead of leaving it get to high incidence. Now, what we've seen is that the virus is not just restricted to the southeast of England. Indeed, it's in parts of Wales, as you showed on your map just before. But it's also, been isolated across the country. So I think that we will have to see, unfortunately, quite severe restrictions coming in place, not just in the southeast.
Do you have any way of modelling the impact of those people who got on trains and left London, or anyone who's already left before the restrictions came into place?
We haven't looked at that, and I don't think anybody has. I think increased contact or increased mixing between the high incidence areas and low incidence areas is only going to lead to one thing, which is slightly, more introductions into low incidence areas. But I don't think that's a major issue, given that actually, if you look at the data, it was already spreading. It's already across the country. It wasn't a fact. It's not just people getting on trains and going, leaving this weekend. It was already established across the country.
You're very clear about the need for further restrictions down the line. Should those extend to schools? I mean, do you think that it would be advisable to have schooling online in January, for instance?
I think this is one of the huge decisions to come. I think it's going to be, and this one really is not an easy one at all. None of these decisions are easy. They're all very difficult. But children have had their education interrupted significantly over the last year, not just during the lockdown initially when the schools were closed, but also actually over the last few weeks when schools have been open, but there's been significant disruption because children having to be excluded and their bubbles being excluded and so on. So there's been very large disruption. So keeping schools open doesn't mean to say minimum disruption to education, unfortunately. Now, I think with this strain spreading much more efficiently, I think we're going to have to look again, unfortunately, at how we can keep schools open in a safe way.
Can you just shed some light on this idea that the mutation exists in many other countries and that the UK has perhaps just picked it up early because of our genomic sequencing?
That's certainly possible. We do have a very good system of sequencing in this country, so it certainly is possible that it's elsewhere and people and other countries don't know about it. There is a very similar strain in South Africa that's been causing very similar problems in South Africa. It's not clear whether these are two independent events, that two similar strains emerged independently, one in the UK, one in South Africa. That's possible, but not good news anyway for the rest of the world, because if it's happened twice, then there's not much to stop it happening 3, 4, 5 times. So, I think we're going to have to wait and see. I think it is, sadly, I think it is quite likely that this strain or some other related strains are circulating elsewhere.
We've already seen dozens of countries shut off their borders to the UK. Should there be more travel restrictions on this end then?
No, I think at the moment it looks like whether we've identified the virus, so I don't think that we need to stop people coming in from France as such. It's the other way around, which is the issue.
OK, Professor John Edmonds, thank you very much for joining us.